Hello, good afternoon. This is BBC News with me, Ben Brown. Our latest headlines. 2-minute silence are held in Reading as people there try to come to terms with the knife attack that killed 3 people. The Home Secretary pays tribute to the emergency services.
These officers, a few of whom were student officers, ran towards danger to help those in need without a second thought. A young unarmed police officer took down the suspect without hesitation.
Ministers are expected to announce tomorrow that the 2-metre social distancing rule in England will be cut. It comes as the UK records its lowest death toll since lockdown began. In Scotland and Wales, more easing of lockdown measures comes into force. Hello, good afternoon and welcome to BBC News as we build up to today's coronavirus briefing in Downing Street. It's led today by the Health Secretary, Matt Hancock. But we'll start with that 2-minute silence that was held in Reading for the victims of the stabbings over the weekend. 3 people were killed in the attack on Saturday evening. In the last hour or so, David Wales has been named as the 3rd victim of the attack. Joe Ritchie Bennett, originally from Philadelphia, was the 2nd victim to be named. He had lived in the UK for 15 years. His friend James Furlong, a history teacher, also died. Pupils at his school in Wokingham, where he taught, have gathered to pay tribute to a man described as very kind and gentle who inspired everyone he taught. Well, the police say they are continuing to question a 25-year-old Libyan man, Khairi Sadallah, who's being held under the Terrorism Act. On a visit to the scene of the attack, the Home Secretary, Priti Patel, said today it was a tragic event and the actions of a lone individual. Our correspondent, Andy Moore, has this report.
Deep emotion and real shock at the school where James Furlong taught and where a 2-minute silence was held this morning. He was much loved and described as a man who inspired everyone he taught.
As a whole community, we all now need to absorb this sad news. Counsellors are available for our staff and students. Words cannot describe our shock and sadness at this time.
He wasn't just every average teacher, he was an incredible person. And he wasn't just a teacher, he was a human being. And he had family and friends that loved him just as much as we do.
The Home Secretary came to the scene of the attack in Forbury Gardens to pay her respects.
What we saw here on Saturday evening in Reading was the actions of one lone individual. We should bear that in mind. The police have that individual in custody. They're not looking for anybody else. We should all remain alert. We should all remain vigilant in terms of the fact that threats are all around us, but we've just got to respond in the right kind of way and be very mindful of, the type of society that we live in.
A second person who died in the attack has been named by his family in America as Joe Ritchie Bennett. He'd been living in the UK for about 15 years. His family said they had lost a brilliant and loving son. Civic and religious leaders from all parts of Reading's multi-ethnic community came to lay flowers at the park. They said the attack was uniting the city in its grief.
We're one united Reading. We're not going to let something like this come into our community. So any form of terrorism, any form it takes, we will stamp that out. So we just stand here to support, obviously, our thoughts and prayers are with the families of victims at this time.
And we're here to stand by the families that have lost loved ones. No one deserves what happened here on Saturday. And we as a community should stand together and say no to any form of hatred, any form of violence.
The man arrested at the scene is Khairi Sadallah, who's 25 and originally from Libya. He came to the attention of the security authorities a year ago when it was thought he might be planning to travel overseas to carry out acts of terrorism. He was investigated but not thought to be a serious threat. At Holt School in Wokingham, students laid flowers to Mr. Furlong. There will be no classes today, and the grief of losing one of their most respected teachers will take a long time to heal. Andy Moore, BBC News.
And Andy joins us live now from Reading. And Andy, now all 3 of the men who died in this attack have been named.
That's right, and we're hearing a little bit more about them. James Furlong and his friend Joe Ritchie Bennett here in the park, just enjoying some evening sunshine on Saturday. They were supporters of the LGBT community here in Reading, and Martin Cooper from the charity Reading Pride said their loss is a tragedy to so many people. They will be sorely missed by myself personally and many in the community. Joe Ritchie Bennett came to the UK from Philadelphia, we understand, about 15 years ago. He married Ian Bennett in 2004, but his partner died of colon cancer in 2014. The third man who died is David Wales, and we believe he was 49 years old. This gateway here leads to Forbury Gardens, where the attack happened. People have been coming up to hand over flowers to the police officers, who then put them at the wall at the back there to grow, to join that growing rank of floral tributes there. Every now and again, we see a white-suited forensic expert still carrying out that investigation in the park. Praise for the police officers who were very quickly on the scene here. One of them, we're told, rugby tackled the suspect, not knowing, of course, if the suspect was still armed with a knife or whether he had a gun or whether he might even have had a bomb on him. That police officer's colleague then administered first aid CPR to some of the victims to do what he could to save them. The suspect, Khairi Saadallah, originally from Libya, he's being held in custody. His flat, a mile or two south of here, was searched. He was known to the security authorities, but they didn't believe he was a serious threat when they briefly investigated him. And police have 2 weeks to question him because he was arrested under a terrorism act. So they have quite a lot of time to establish the background to what happened here on Saturday evening.
Andy, many thanks. Andy Moore reporting there from Reading. The Prime Minister has been meeting senior cabinet members and leading scientific advisors ahead of an announcement that is expected tomorrow that social distancing in England can be reduced from 2 metres to 1 metre, with some conditions. It's thought the move will be timed to coincide with a further reopening of businesses, including pubs, bars and restaurants, early next month. Well, meanwhile, the number of people in the UK who have died after testing positive for coronavirus has risen by 15 to 42,647. Now, that makes it the lowest number since the middle of March, although figures do tend to be somewhat lower after the weekend because of delays in recording deaths. In other developments, the Childhood Trust is warning today that children are developing serious mental health conditions, including post-traumatic stress because of the coronavirus pandemic. There's also been a report suggesting that the pandemic has added to existing inequalities, with lower income households turning to borrowing, while those on higher incomes have been able to boost savings. And a new test for COVID-19 using saliva samples is to be piloted in Southampton in the next few weeks. Thousands of participants will complete the tests at home to see if they can provide an alternative to swabs from the nose and throat. This report now from our health correspondent, Lauren Moss.
Keeping our distance, it's become a way of life. But just how much is the subject of debate. It's expected that tomorrow the government will announce the findings of a review, which could see the distance relaxed from 2 metres to 1 in England, but with some strict conditions.
There has been a great deal of work that's been taking place at pace over the last number of days, informed by the science, informed by experience from around the world as well, as to how we can appropriately look at easements and appropriately also reflect on the 2 metre rule as well.
Wider use of face coverings and perspex screens will likely be among the new guidelines. The changes could be in place by the 4th of July, the earliest day restaurants, bars and hairdressers may reopen in England. As businesses prepare, there are calls for urgent clarity.
We as an industry have always managed people. That's what we do. The safest place to drink is in a safe, licensed environment where you're being monitored already by the staff in that environment. But if it goes above and beyond that, this will become other burdens for an industry that is already having to put in a lot of safety measures in place.
Other countries, including China, Denmark, Hong Kong and Singapore, already follow a 1 metre rule. UK experts say it's a bit of a balancing act.
1 metre seems like a reasonable compromise between safety but also what is practical. And most people agree that what we want at the moment is something practical. The levels of the virus circulating in society are really very low now.
Testing for the virus and tracing those who may have it will be just as important as we ease further out of lockdown. A trial on a new saliva test is now underway to find out if people can test themselves at home without needing to swab the nose and throat.
Delivery for you.
Also under consideration is the advice to shield and stay home that's been given to more than 2 million people who are clinically extremely vulnerable. As more of the country prepares to reopen, it's not without a warning from the Prime Minister that there'll be no hesitation to apply the handbrake if COVID cases rise again. Lauren Moss, BBC News.
Well, ahead of the Downing Street briefing at 5 o'clock, let's talk to our political correspondent Nick Eardley at Westminster. And Nick, we're expecting tomorrow that news that the social distancing rule will be cut from 2 metres to 1 metre. But there's been huge pressure, hasn't there, for what feels like weeks now on the government to cut this, from businesses, from Tory MPs and lots of people.
Yeah, you're absolutely right, Ben. And I think this is part of what this week's strategy is all about. It's giving businesses, be they shops, bars, restaurants and other facilities, a bit time to get ready for the reduction of that 2 metre to 1 metre, probably around the start of July. Anybody who's walked up and down a high street in England over the last few days will have seen big signs telling everybody to stay 2 metres apart. So this is a pretty big change to something that's become pretty fundamental to our lives over the last 3 or 4 months. The health context for this is pretty promising for the government, actually. The stats we've seen today are among the best we've seen for months now. The lowest number of deaths since March, 15 across the UK in the last 24-hour period. Likewise, fewer than 1,000 new cases confirmed of the virus in the last 24-hour period. There's a caveat, which is that things are often lower at the weekend, but clearly things the government hopes are going in the right direction in a health context. Politically, the last couple of weeks has been a bit tricky for the government. Not everything is going according to plan. There are some Tory backbenchers who are less than impressed with the way the government dealt with things like the fallout from announcing that they weren't going to have the app in the way that they hoped run by the NHS. Likewise, there was that U-turn on free school meals in England, all a bit tricky for the government. So getting it right will be important for Boris Johnson this week, but it is absolutely a big week for potentially easing some of those restrictions in England and finding out what the next few weeks and months might look like for people's lives.
Nick, thank you very much indeed. Nick Eardley there, our political correspondent. Well, let's get a bit more now on that expected announcement tomorrow from the Prime Minister. As Nick was saying, that social distancing in England could be reduced from 2 metres to 1 with some conditions. We can talk to Wendy Wakeman, who's co-owner of the Gardener's Arms in Alderton near Tewkesbury and has been busy carrying out renovation work there in order to make it safe for her customers when they do return. Thanks for being with us. How big a difference will it make to you to have that social distancing rule cut by 1 metre to 1 metre?
It'll make quite a lot of difference. But at this stage, we're quite cautious. So we are more than happy to adhere to the 2 metres. So we've actually set up for 2 metres here. I'm more than happy just to cut from 84 covers down to 30 to make my clients safe.
OK, so you're going to stick to the 2 metre rule, even though if there is this announcement tomorrow, you wouldn't necessarily have to?
I think the clientele that we have, slightly older clientele, will want us to feel that we're looking after them, they're keeping them safe. I mean, my husband and I need to talk about it. We've been adapting and changing each week with the new rules and regulations, and we've got to look at it to see if it's feasible.
So you're saying you're going from, what was it, 80 covers to 30. I mean, is it profitable to operate like that?
Yes, well, we've got an outside bar bus, so the drinkers can go out there, and there's a lot more space out there. We've got a lot of tables and blankets and stuff like that they can sit on, so I'll have no one coming to my bar inside. They will be taken to a table and adhered to, you know, according to what we've set up. So I'm even taking temperatures of my clients and my staff.
Right. And what other precautions, what other safety measures have you taken?
Basically, we've opened the toilet doors so they don't have to touch handles. I've got things like salt and peppers and sugars and all that sort of stuff, all in packets now. There's no grinders, there's no ketchup bottles. The cutlery will be provided in it's like a sleeve so that you're not handling the cutlery as well. There's so much we've had to do. I've got an anti-bac station in the hallway. Trouble is, you can't wear gloves. The girls, it will melt with the hot plates. It'll melt, and then if you put those white gloves on that you see at these really posh restaurants, they get dirty so quickly. People are going to go, oh, don't hand me my food with that. So it's just getting them to wash their hands really, really regularly will work.
I must say, it sounds like you've thought of pretty much everything, and full marks for that. And I suppose part of it is that, you know, you want to encourage people to come back, don't you? You want your customers to come back, and they have to feel safe. You have to reassure them in a sense.
Yeah, well, according to the statistics we've been getting from our people, 25% couldn't care less or come back no matter what. 35% want to actively see that you've done something, that you've got your signage up, that you're talking to them and you've got the anti-bac and so on and so forth. And the other 45% will try and come along and see, maybe a lot less often than they used to.
Wendy, great to talk to you. Really good luck when you do reopen. Many thanks for talking to us. Wendy Wakeman there, co-owner of the Gardener's Arms in Alderton near Tewkesbury.
Thank you.
Pay it a visit. Just some news coming into us from Northern Ireland, actually, before we go on to discuss the 2 metre rule in a bit more detail. And we're just hearing that indoor meetings are to be allowed from tomorrow of up to 6 people from different households in Northern Ireland. The decision on the relaxation of restrictions was made at a meeting of ministers in the devolved government there at Stormont. People still being encouraged to follow social distancing and advised to wear face coverings. Overnight stays not permitted, but from tomorrow, indoor meetings allowed in Northern Ireland of up to 6 people from different households. So that just in from Belfast. Well, let's speak now to Peter Drobak, who's a global health physician at Oxford University, and he's going to talk to us, first of all, about social distancing rules. And do you believe it would be OK to cut it from 2 metres to 1 metre tomorrow, which is the announcement we are expecting?
Yeah, I'd be concerned about that change, and I think it's too soon to further relax these measures. You know, we've seen some positive trends in terms of declining numbers of cases and deaths in this country, very welcome, of course, in recent weeks, but we're still seeing about 20,000 or more new cases in the UK every single week. Two out of 3 new cases are not even being diagnosed and reported. So what that means is that even with the infrastructure we have in place, there's a lot of invisible silent transmission that's still happening. And so every step we take to start to reopen things, I think we increase the risk of a second wave. And you know, the science is complex on the distance rule, because it's not only how far I am away from another person, it's whether we're indoors or outdoors, how long we're in contact for, whether we're speaking or shouting or coughing. But what's clear is that 1 metre is higher risk than 2 metres.
Yeah, but having said that, the World Health Organization recommendation is 1 metre, and quite a lot of other countries have 1 metre. So 2 metres isn't sort of set in stone.
That's correct. It's not set in stone, but it's safer than 1 metre. Now, if you look at a lot of other countries that have 1 metre rules, and many that have been more successful in controlling the virus than we have thus far in the UK, one of the big differences is that use of face masks is much more common. And that's something that I think is really important. There's really an overwhelming amount of evidence now that's emerged in recent months that face coverings can really decrease transmission. So what I'd like to see first would be for us to have face coverings become commonplace in public areas, particularly in indoor spaces. That's going to make us much safer and get us to the place where it'd be less of a risk to go from 2 metres down to 1 metre.
Do you think on face coverings that the government's been a bit slow to recommend that? Because there was some doubt, wasn't there? I mean, some of the scientific advisors were saying in the Downing Street briefings in weeks gone by, you know, there was only weak evidence that face coverings actually really work.
Early on, many of the public health community was skeptical that routine use of non-medical face masks would make a big difference, but we've learned a lot over the last couple of months. The big thing is that we now know how important asymptomatic or pre-symptomatic transmission is, meaning I can be infected still feeling healthy and can infect others around me. And what that creates is a situation where just testing and tracing isn't enough because a lot of transmission is happening before people feel sick. And so since then, we've seen quite a number of studies that have really demonstrated a substantial decrease in the risk of transmission when face coverings are common.
Good. Oh, well, we just lost the line, but we're pretty much finished anyway. But that was Peter Drobak, and very grateful to him for his time, Global Health Physician at Oxford University. You're watching BBC News now as black authors top the bestseller charts in the wake of the Black Lives Matter protests spurred by the killing of George Floyd. The newly formed Black Writers Guild, which counts among its members some of Britain's best-known authors and poets, has written an open letter calling on all major publishing houses in the UK to introduce sweeping reforms to make the overwhelmingly white industry more inclusive. At all levels, members of the Black Writers Guild include Mallory Blackman and the Booker Prize winner Bernardine Evaristo. And we can talk to Bernardine Evaristo right now, actually, who won the Booker Prize last year for her novel Girl, Woman, Other. Many thanks indeed for being with us. Congratulations for being top of the charts. Is it a surprise to you that you are the first woman of colour to be topping the bestsellers list in this country?
Actually, it was last week, and I was top of the paperback fiction list, and I was the first woman of colour to be so. I was really shocked, actually, just to say that Reni Eddo-Lodge this week is the top of the bestseller list for all genres. So, and she is the first British woman or British person to be on the top of that list. So there are a couple of firsts that have happened recently, and I think it's astonishing because I don't think we realised that our books were not selling in this way, and now that they are, it's terrific. And yeah, it's a good place to be, but I think it is a bittersweet experience because, in the 21st century, it really shouldn't just be happening now.
And you're one of the signatories to this letter calling for real reform in the British publishing industry. What sort of reforms do you want to see? What are you saying to them exactly?
Yes, well, just to say that we formed a Black Writers Guild, and there are 200 members of the guild, which is incredible. But it was actually formed by the writers Afua Hirsch and Nels Abbey and the publisher Charmaine Lovegrove. I'm just one of the signatories. And it really is for the publishing industry to take stock, to do an audit of the ways in which black people are not present in their publishing houses, and to commit to doing better. If I just give you one example, there's a poetry publisher in this country. It's been going 91 years. They've only ever published 5 poets of colour, only 1 black man. They've never published a black woman. So we really are not in a very good place in terms of the publishing industry being more inclusive. Some publishers are trying to improve that. Some, I think, will be doing so now. Once the letter went out, I think it was a bit of a wake-up call for the industry.
I've heard the industry described as a hostile environment. What is meant by that exactly?
Well, I didn't say that. I don't see it as a hostile. The publishing industry is very liberal and very genteel, actually. But I think the results speak for themselves because there are so few black writers being published, and because the industry is, as you said, overwhelmingly white, then there is an issue. And people of colour and black people have been talking about this for a very long time to the industry, and nothing's really changed. So we need to see the industry now taking stock, self-interrogating, and putting practical plans into action to redress the balance.
What would you say about this wave of discussion, really, protest and discussion that we're seeing in the wake of George Floyd's death in Minneapolis? It's extraordinary. I mean, we are doing this interview now because of what happened to him a few weeks ago in Minneapolis.
And what happened to him was tragic, and it was a terrible kind of trigger for this worldwide resurgence of Black Lives Matter. But what's really interesting at the moment is that Black Lives Matter has been taken much more seriously than previously. And so a lot of the institutions, even the corporations, organizations, as well as individuals, are thinking very seriously about race now, which is why so many books by people of colour have hit the bestseller lists, because people want to look at racism and to try and understand what it is and how it can be tackled.
Talking about corporations, which you just mentioned, I mean, we here at the BBC, our Director General Tony Hall's just committed to spending £100 million over 3 years to increase diverse and inclusive content. Is that also an example of what needs to be done across the creative industries in the UK?
Absolutely, absolutely. You know, often, you know, in the arts, people of colour are the performers, or, you know, the writers, not so much in publishing, but in theatre, for example, or for screenwriting. But we're often not in positions of power, and that's where we need to be. You know, we need to be there at the board level, and then every kind of stage down to the warehouse. So I think everybody needs to think very seriously about how they can make their industry much more inclusive for everybody. And black people in particular have been hard done by for a very long time, and we are being heard now. So I do feel more hopeful than I ever have before. We've had so many reports, so many reviews, and really very little has shifted. Some publishers have done better than others, as I said. So, for example, I'm with Penguin, and Penguin have had diversity initiatives and actually published a lot of writers of colour in the last few years. What we want to see now is to see that sustained for a lifetime. You know, we are citizens of this country. Most of us are born here. We are invested in this country. We pay our taxes. We're part of the culture of this society. And, you know, we want to express ourselves through literature and through all kinds of genres, from cookery books through to high literary fiction. And so far, a lot of those doors have been closed to us. So we need to see that change happening now. It seems to be happening, and we need to monitor it.
Great to talk to you. Thank you so much for your time today, joining us here on BBC News. Bernardine Evaristo, the Booker Prize winner. Many thanks indeed.
Thank you.
Now let's return to coronavirus, and all non-essential shops are allowed to reopen across Wales today in the latest easing of lockdown measures there. However, the 5-mile limit on non-essential journeys does remain in place, with a review expected to take place by the 6th of July. Our correspondent Thomas Morgan has more.
After almost 3 months, the customers are ready for high street shops to open again in Wales. But the experience this time will be a little different.
If they do try something on and they don't purchase it, we take the item out to the storeroom and we steam it.
Jamin Patel has been preparing for some time, aiming to make sure safety is the priority for customers and staff, as the 2-metre rule is written into law for employers in Wales. Jay's adapted and done well online selling clothes during lockdown, but nothing can replace the business that's brought by footfall.
We wanted to make customers feel safe, but still let them have that experience of being able to go shopping again. And, you know, a shopping experience is something, especially for a small independent like ourselves, it's quite personal. We've decided we'll let 1 or 2 people in at any one time.
In preparation for shops to reopen here in Wales today, the council here in the city centre in Cardiff have put a number of provisions in place to help keep things safe for shoppers. They've extended pavement areas across the city, and here on the high street in the city centre they put a one-way system in place so the shoppers can go about their business at a safe and social distance.
I think it's a very good idea myself that they've got the measures, and yes, I am looking forward now after all that lockdown.
It's okay, I don't feel like anyone's really following it though. Like the systems are in place, but yeah.
3 weeks ago, the Welsh Government told shops to prepare for this day, so long as the virus continued to decline. But some retailers across the country say that still wasn't enough warning. As one sector restarts, further lockdown measures are being discussed on the Isle of Anglesey to contain an outbreak at a chicken manufacturing plant. Work has been suspended there, with all 560 workers now self-isolating. The stay lockdown rule remains in place in Wales, meaning people should only travel within 5 miles from their home. It'll be around another 2 weeks before that restriction is lifted and people here can travel further afield again. Thomas Morgan, BBC News, Cardiff.
Now, we're just a minute or so away from today's coronavirus briefing at Downing Street. It's led today by the Health Secretary, Matt Hancock. Alongside him will be Jenny Harries, Deputy Chief Medical Officer for England. Just in the run-up to that, let's talk to our political correspondent, Nick Eardley, who's at Westminster. And Nick, we will rudely interrupt you, I'm afraid, as soon as it starts. But let's ask you a quick question. There won't be an announcement today on cutting social distancing rule of 2 metres, but we are expecting that tomorrow.
Yeah, I think this could be quite a big week for more details of how the next set of restrictions will be lifted in England. We know that the Health Secretary and Dr Harries are going to be delighted by some of the figures we've seen over the last 24-hour period. Fewer deaths, just 15 than we've seen since March. Likewise, less than 1,000 new cases of coronavirus were confirmed. Usual caveat, they're always lower at the weekend, but I think that gives the government some confidence that now is a good time to think about easing some restrictions further. So as you say, today we're going to see the discussion of whether that 2 metre rule can be reduced. It's actually just after the press conference. Matt Hancock will be one of the ministers there with the Prime Minister and the scientists and the medical officers making that decision. But all the expectations are that in England it will be reduced potentially in a couple of weeks' time when the next phase of the lockdown easing is introduced in England. That's likely to see some lifting of rules on hospitality as well, with some conditions like perhaps more wearing of face coverings, perhaps things like perspex screens and easier contact tracing, so leaving your number and your details if you book a seat in a restaurant or in a bar. But look, there are lots of other questions for Matt Hancock and Dr Harries as well about what the next few weeks are going to look like for people who are shielding in England. That's gone on for a long time now. 2 million people plus are still shielding in England and are still looking for some more detail of what the next few weeks might look like. And as we've seen over the last few weeks with these press conferences, Ben, anything can come up really. The government's under a lot of pressure and a lot of issues, and there are a lot of questions that people want answered.
Yeah, we'll see what those questions are. That news conference just about to get underway, as Nick was saying there, with Matt Hancock, the Health Secretary, and Jenny Harries. Just in a few seconds, all along this has been a question of balance for the government, balancing the economy and the health situation, livelihoods against lives.
Yeah, you're absolutely right, and that's why the meeting that will be taking place later this afternoon to make the decision on that 2 metre rule won't just have the health experts. It's also been taking evidence from economists. The Chancellor will be there, the Business Secretary, all those people feeding in to the conversation about how you balance the health
Nick,
impacts.
thank you. Here is the Health Secretary.
Downing Street for the daily coronavirus press briefing. I'm joined by Deputy Chief Medical Officer Dr Jenny Harries. Dr Harries is going to set out our next steps for those people who have been shielding for the last 3 months. But just before we do that, I'd like to take you through the latest data. If we could have the first slide, please. This slide shows the number of tests that have been carried out, now over 8 million tests in total. And it also shows that for the first time since the peak, the number of cases confirmed, positive cases, is under 1,000 at 958. Next slide, please. The second slide shows the number of people in hospital. The top of the two shows the number of people admitted to hospital with COVID-19, which is 380. That's down from 432 a week ago. And the bottom chart, shows the number of ventilated patients, that is patients on a mechanical ventilator, and that number is 330, down from 395 a week earlier. So clearly the number of people going into hospital and the number of people in the most serious condition in hospital on ventilated beds both coming down. Next slide, please. The regional picture is broadly the same across the country, and for the first time since the peak, there are fewer than 5,000 people in hospital with coronavirus. And if we go to the final slide, thank you. Thankfully, the number of people who have died from coronavirus each day is also coming down. The latest data show that yesterday 15 more deaths were reported. This is the lowest figure since mid-March, since the 15th of March. And each of these deaths is someone who is loved and someone who we mourn. And each death is one death too many. Nevertheless, the fact that we have a figure of reported deaths that is 15, much lower than any previous figure since the peak, is good news. However, it's a weekend figure, and we do see the number of deaths reported tend to rise after a weekend. Nevertheless, having set out all of those statistics, if you take into account the number of people in hospital, the number of people going into hospital, the number of people testing positive, and the number who sadly have died, all of those figures are coming down and pointing in the right direction. It shows that whilst there's still much to do, we are clearly making progress. We're working through our plan, and this data shows that that plan is working. We protected the NHS, and thanks to the patience and the sacrifice of everyone watching, infections are falling, the NHS is restoring, and the virus is in retreat. A month ago, around 1 in 400 people had the virus. Now it's around 1 in 1,700. And this means that tomorrow the Prime Minister will be able to set out the next steps in our plan to ease the national lockdown. But there's one group who've been more patient and given up more than almost any other, and that's the 2.2 million people who've been shielding in England. Wales, Scotland and Northern Ireland have their own shielding programmes, so what we say today is about England only. And since the start, the clinical advice has been to protect those who are clinically extremely vulnerable. Our shielding programme has delivered medicine, support and more than 3 million food boxes, and it's been integral to that plan. So just before turning to Dr. Harries, I want to speak directly to those of you who have been shielding. Like so many, I have friends, I have family who've been shielding, and I know what a burden it has been. Shielding has involved not leaving your house for months, not seeing people who you love, not being able to go to the park for some fresh air or even pop to the shops for something that you need. The sacrifice, though, has been for a purpose, and I want to thank every single one of you. We knew it was a difficult ask, but these measures have been vital in saving lives. Right from the start, we've been clear that we didn't want the shielding advice to be in place any longer than is clinically necessary. I'm very, very grateful to the clinicians who've led this work and kept the clinical advice under review. So Dr. Harries will now set out the next steps in that clinical advice, and then I'll set out the practical support that we'll be maintaining. Jenny.
Thank you, Secretary of State. I thought it might be helpful to say a few words on the clinical basis for the current shielding programme, what we're advising now and what we might see in the future. And that is particularly to the adults, but specifically also the children who've been shielding. This is a new virus. We're continuing to learn about its transmission, and that knowledge will continue to grow over coming years. At the start of the epidemic in the UK, using the information we had available and our best understanding gained from other respiratory viruses such as flu and SARS, we recognised that some people would likely to be more vulnerable to severe outcomes from disease than others. This included older people and those with underlying medical conditions, and those are normally the people who would have a flu vaccination each year. This clinically vulnerable group we advised to be particularly stringent in following social distancing guidance, and that recommendation continues. But senior clinicians recognise that for a small subset of the population there may be an even greater risk. So, for example, this would be those who may be on particularly high combinations of immunosuppressive treatments, or where their disease was particularly poorly controlled. And this group, the clinically extremely vulnerable, were those that we advised to shield. Shielding doesn't alter the risk to an individual of illness if they become infected, but it does reduce the likelihood of meeting the virus in their daily lives. Now we're out of the peak of the epidemic in the UK, and estimated levels of community transmission and infection are back to those before shielding commenced. We're in a position to start relaxing the shielding advice over the next few weeks. We may well actually have some summer weather a little in our favour too, and therefore our advice to those shielding is to take some steps now to start coming back to a more normal lifestyle. This has been a very difficult and sometimes frightening period for people who've been shielding, and therefore to give people time to prepare, we're setting out the advice in a stepped approach. So first from July the 6th, which is a time period from when other lockdown measures have been eased, so we can ensure we're monitoring the epidemiology continuously, we're advising that people who are shielding may want to start meeting in groups of up to 6 people outdoors, including those outside their household. If you live alone or you're a lone parent, you can think of forming a support bubble with another household. Those in a support bubble can then spend time in each other's homes, including overnight. And then secondly, from August the 1st, we will pause shielding. We'll still be advising people to stay at home as much as possible and to minimise contact with others outside their household. But from August the 1st, our advice would be that people can go out to more places, see more people. This might include going to the shops, for example, or visiting a place of worship. If you do leave your home, you should continue to keep a safe distance from other people at all times. Regularly washing your hands for 20 seconds is still one of the most effective ways that you can protect yourself. If you're unable to work from home, from August the 1st, you can return to work as long as the business is COVID safe. When this programme started, we used a precautionary principle. New evidence is telling us that the risks for individuals are often more clearly due to a combination of factors in that individual, such as age, ethnicity, obesity levels, for example, as well as the medical conditions that they have. The Chief Medical Officer has commissioned work to ensure that should we need to step up the shielding programme again, we would have available a much more individualised way for you and your doctor to be able to understand your risk and to receive more tailored advice. The new risk assessment research methodology is being published today by academic colleagues led by Oxford University. In the future, therefore, those we advise to take action may be a slightly different group to those who've shielded through this new disease peak. One group where this is particularly relevant is for children. As evidence has evolved, we've seen that admission to hospital for all children under 18 years old with COVID-19 is very low indeed. Only 36 children in the UK have been admitted to intensive care. Shielding guidance to date has covered a broad range of conditions and clinical vulnerabilities. We know that many parents have been worried about how they can protect their children, and they often carry a considerable burden themselves. Now we have new guidance developed by the Royal College of Paediatrics and Child Health, and this will help families understand who does and does not need to shield. Now we have more evidence, we can be much more specific about risk, and it's very likely that in the future, very few children will need to shield. The evidence the children's clinical experts have brought together strongly recommends that children and young people who are cared for just in primary care are very unlikely to need to continue to shield in the future. There is a group of children that exist who, due to their underlying conditions, may need to continue to shield. But over the summer, parents can look forward to discussions through routine paediatric appointments, and in the interim, we will be talking with your doctors and the Royal Colleges to ensure everyone has the right information. So for now, there is no need for parents to speak to their doctor immediately, and we will sort that information out in due course. For anybody with underlying clinical conditions, whether adult or child, looking forward and after shielding advice is paused, we would still continue to advise you to be careful. Keep your overall social interactions down as low as feels comfortable initially, whether at home or at work, and keep practicing good hand hygiene and good respiratory hygiene. And finally, I would just like to say a special thank you to clinical colleagues, particularly in primary care and specialists in hospitals, and all of their staff who've been working hard to support those shielding over the last 3 months.
Thank you very much indeed. Now, if you'll allow me, I'll take 1 more minute just to set out the practical consequences of all this. And I'm sure the whole nation is grateful, Jenny, that your wisdom is guiding this work. And we're very grateful for you setting out the clinical advice so clearly. Over the next few weeks, we'll all have time to prepare for these changes. First, in the coming days, as I promised, I'll write to everybody on the shielding list with further details about what this means for you and what to expect. And we'll update our online guidance in line with these changes. I know that after 3 months of shielding, it might take a bit of time to adjust to the new guidelines. So we're working closely with the NHS, with councils and charities to make sure this updated advice is as clear as possible. If you're receiving centrally provided food boxes or medicine deliveries, this will continue until the end of July. And I'm glad to say that 7 supermarket companies have confirmed ongoing access to priority supermarket delivery slots for as long as they are needed. Support from NHS volunteer responders will continue, and so too will the support from NHS mental health services for those struggling with their mental health. And for anybody facing financial hardship, we've made money available to councils to help those struggling to buy food and other essentials. And my message to employers is crystal clear. Please work with us to ease the transition back to a more normal way of life for shielding employees. We expect you to do the right thing. Nothing matters more than keeping people safe, and we will keep the evidence about the risks to people under constant review. The NHS will maintain the shielded patient list, and we stand ready to support people to shield again if that's what's clinically required, including through an enhanced digital platform. The support for the shielded has been a huge effort of community spirit, with practical and emotional support alongside the brilliant work of Public Health England and the NHS, supported by my department, the Communities Department, and under the leadership of Chris Townsend in government. So I want finally to say a huge thank you to those who've shielded, to all those who've looked after them, and to each and every one of you who've played your part in the national effort to bring this virus under control. So let's keep going and stay alert, control the virus, and save lives. We'll now turn to questions. In the first instance, questions from the public. The first question is from Alan from Romsey by video.
Good afternoon. The government is borrowing unprecedented sums to fund the current pandemic. What infrastructure projects in the short and medium term and the support of the individual will need to be reviewed as a consequence of this level of borrowing? Thank you.
Well, thank you, Alan. It's an important question because there clearly has been, as well as the huge health consequences that we've been talking about today, there's huge economic consequences from this pandemic. And I'm glad to say that our view on infrastructure projects is that we need to accelerate them rather than slow them down in order to provide for a bounce back in the economy that I'm sure everybody wants to see. So that is very much led on by my colleague Rishi Sunak, the Chancellor of the Exchequer, who I think has been doing an absolutely brilliant job. But our overall approach is, yes, unfortunately, borrowing is obviously going up, but this is a one-off, hopefully once-in-a-century event, and we therefore want to keep investing in our infrastructure and, if anything, accelerate our investment in our infrastructure so that we can get the economy going as soon as we can bring the virus under control. The next question has been sent in written form from Mandy from Salisbury. Mandy asks, with Ryanair and EasyJet commencing flights or getting ready to commence flights on the 1st of July, Can you clarify what work is being done to establish and formalise travel corridors? Well, thank you, Mandy. Thanks for that question. You're right that a lot of work is being done on travel corridors. I've been working on it over the weekend. And we have a formal review date of the quarantine policy at the end of this month, on the 29th of June. And we'll make sure that in good time for that, we publish what we plan to do next in terms of where we think, again, based on the epidemiological advice, where we think we're able to formalise travel corridors. I know that people are really looking forward to getting this information, but we've got to make sure that we get it right, and that work is going on right now. So I'm sorry I haven't been able directly to answer your question, other than to assure you that we're working on it very intensively. The next question is from Hugh Pym of the BBC, who joins us live. Hugh.
Thank you very much, Secretary of State. Some people have told us that even after shielding ends, they will be concerned about leaving home and going back to work. What reassurances can you give them that that will be understood and they will get full support?
Thanks, Hugh. I think this is a really important question. And it's so important that employers work with us and, crucially, work with their employees to support them to get back to work in a COVID-secure environment. And it's critical that work is provided in a COVID-secure way for people who are shielding. But I'd also say that we've taken this step based on the clinical evidence and the clinical advice. Jenny.
Yes, so I think a couple of points there. Firstly, to absolutely acknowledge that people who've been shielding, many of them are quite frightened and anxious, understandably. Many have not been taking many steps outside, and I know that from speaking to GP colleagues, for example. The important thing here is that the shielding programme is not so much about the individual interaction with the disease, it's actually a population-based exercise. So we know, and we've seen from the slides today, that the infection in the community, those rates have come right down. So we can never be 100% sure. We all have a small residual risk, but I think, firstly, the epidemiology is right. Secondly, although we don't really understand the seasonal effect, it does look a little bit as though that may be helping disease at the moment. And I think, thirdly, which might be the most important bit for those who are shielding, is that, in fact, all of the guidance for businesses in terms of mitigating risks, making sure that businesses are COVID safe, actually comes through, much of it over my desk individually and with Public Health England colleagues, and we scrutinise that to make sure that the steps that the businesses have to put in place are the ones which will maximise the safety of all their employees, but I think particularly important for those shielding.
Thanks, Hugh.
Just, can I add one more? You aren't going to end statutory sick pay for the shielded. Isn't that another source of potential worry if they really feel they can't go back to work?
Well, again, Hugh, we've taken this decision based on clinical advice of the safety of being able to go back to work when the shielding programme is paused. We've extended it until the end of July, and then it'll be paused. And I use the word paused very deliberately because the list will continue, and should the clinical advice be that we need to bring it back in, then that's what we'll do. And of course, we want to support people to get their lives back to as close as normal as possible, especially for those who've been shielding, for whom the advice has had such a very big impact on their lives. Thanks very much indeed. The next question is from Emily Morgan from ITV. Hi, Emily. You're silent still.
Hello.
Hello.
Hi. I'm just picking up on what Hugh Pym was asking. It appears that you're going to be relying on the goodwill of employers to help support shielders. But what measures are you actually going to put in place to legally protect those who don't feel safe going back to work and whose employers perhaps can't keep them on or who simply aren't supportive of those shielders?
Well, of course, the legal framework for people at work continues and exists and has been in place all the way through this crisis. And we wouldn't take this step to say that after the extension that it is safe to pause the shielding advice unless that was what the clinicians advised. So Dr. Harries has been leading on that advice and taking all of the risks into account. Jenny.
Yes, I probably just wanted to add something just from, it won't apply to everybody, but I think there is quite a difficult balance here because for many people who have been out of normal societal circulation, if you like, actually having a job, going to work and doing something purposeful is really important for your ongoing health and your economic and mental health as well. And so what we've done with the programme is put a very extended period in. From the epidemiology today, it would really be possible to say, actually, let's advise everybody to jump back into work today. But we absolutely recognise that that's not what's going to help people pick up the confidence, I think, to go back. So I think it's a combination both of having employers who are prepared to share, have those individual conversations, share the changes that have made in their environments, and to reassure them that they are COVID safe. And equally, time for individuals to be able to get used to the idea, if you like, of getting back and not going straight back into work this week or next, but actually over a time period. So I think there's a benefit on both sides, and it may actually, although people will be fearful, they perhaps sometimes do need to push a little bit in order to get the benefit back themselves.
Thanks very much. The next question is from Sam Coates at Sky. Sam.
Secretary of State, today the Governor of the Bank of England, Andrew Bailey, told Sky News that in March he stepped in with a massive money printing effort when it looked like the government might not be able to borrow enough through normal means. Looking ahead, does the Bank of England's safety net give you comfort that you can continue to do whatever it takes economically as you work to prevent a second spike or spike in unemployment in the coming months? And Dr. Jenny Harries, two things. Do you think that children shielding will be able to go to school in September? And also, the Director General of the World Health Organization has said that globally yesterday there were 183,000 new cases of coronavirus, which he said is easily the most cases in a single day. Does that give you any pause for thought?
Well, thanks, Sam. The Governor of the Bank of England and the Chancellor and the Prime Minister have been working very closely together on the economic response, along with the rest of government. It's so important that the institutions that govern our economic policy have worked together in the way that they have. The Bank of England, independent, of course, but nevertheless able to support the economy in these extraordinary times. And I think that the way that the Bank of England has handled this has been absolutely exemplary. And they have done a terrific job, naturally, managing the economic fallout of a pandemic that's had the consequences that it has had economically is an incredibly difficult job. But I think that the bank have very much played their part. And obviously, looking forward, it's very important that we manage the economy as best we possibly can to get it. Bring it back as much as we can, subject obviously to the safety of keeping the virus low, because if we ended up with a second spike that overwhelmed the NHS, then obviously that would have huge negative economic implications. So there isn't a trade-off there. There is, but it's something that we all work on together. If I may, if I tie. I'm also going to have a go at your third question, but because it ties in with what Mandy from Salisbury asked as well, which is that, of course, we look with the clinical advisors, we look at what's happening around the world, and this shows why it is important that we have a quarantine process in place, because there are some parts of the world where, unfortunately, this virus is really shooting up. Jenny.
Thank you. Yeah, so perhaps just adding on to that, of course, as you look across, it's countries which have not experienced this so far, which are largely contributing to that massive climb. So the Americas, Latin America, and I think we are concerned looking forward about global cases, particularly focused on in Africa as well. Your viewers will have seen the epidemic peak that's happened in the UK and many other countries, and they haven't peaked yet in those countries, so we can anticipate there will be a lot more cases, sadly. On the point about children, absolutely. I think the good news in many ways about the new research, and I would direct your viewers and worried parents to the Royal College of Paediatrics and Child Health. We'll put a link on our guidance, but if they just Google RCPCH, or other network chains are available. But if they look on that, they will see some quite detailed information that will allow them really to get a sense of where their child fits into that risk picture. What we know is that there are almost certainly a large number, very large number of children who are not going to school at the moment, who could go because parents are concerned that they should be shielding. So a typical example, but not the only one, would be a child who has some asthma, but it's very well controlled. They don't normally see a specialist, or they may have seen them once or twice. They see their GP occasionally who checks on them. They may well be growing out of it. They perhaps get it when they run around a bit and do some exercise. Those children are at all very, very low risk from COVID. They are probably at very, very significant risk of getting left behind in their education. And in terms of their long-term health outcomes, that will be far worse. So absolutely, we anticipate that sort of by September, clearly there's a time for this to work through, to make sure everybody, particularly our doctors, have good advice to be talking with parents. So not immediately, not tomorrow, this week, but over the coming weeks, so that by the time we're back into September, when we'd anticipate schools will be fully open with all children attending, there should be a much fewer number of children who are on the shielding list who would need to be away from school.
Thanks very much, Sam. The next question is from Oliver Milne from the Daily Mirror. Oliver.
Hi, Secretary of State. You've said you're going to rely on the goodwill of employers, but the reality is employment law exists because bad bosses don't listen to appeals to their compassion. Are you willing to consider, as trade unionists and campaigners have demanded, changes to the law to give legal protections to those who are most vulnerable at this time as they return to work? And Dr. Harries, you spoke about the complexity of the and range of the underlying conditions that people who've been shielding have experienced. But this advice is being lifted all at once for all of them. Now, there will be people, and we know because they belong to certain socioeconomic groups, or they are a member of an ethnic minority or suffer from poverty, or because they have very serious underlying health conditions, who may be more at risk than others, even within this shielding group. What advice do you have for them? And if they're concerned, should they speak to their GP?
Thanks very much, Oliver. Precisely to the point in your question, there are those legal protections in law, absolutely. And we've been advising people to shield, but because the clinical advice is that it is safe to change that advice from the 1st of August, having extended it for a month, for this month coming, then we're bringing forward the changes because the clinical advice is that it's now safe for people to go back to work. And of course, employers need to follow COVID secure guidelines as has been set out in government guidance. On the second question, I'll hand over to Jenny.
Yes, thank you. So first important question is, do not all go off to your GPs tomorrow morning, because that probably won't help the GPs or you. But in fact, it shouldn't be necessary. Firstly, as we've said earlier, the guidance is being stepped ahead, if you like, so people have plenty of time to think through. We can discuss with, which we have done already, but have continued discussions with colleagues in the Royal College of General Practice, for example, and in Paediatrics and Child Health, and that their members can then have those very solid discussions with people who are shielding. But it goes back a little bit to why the shielding programme came in. So it is not, we recognise a group of people with risk, and they will have slightly different risks. But actually, it is the epidemiology which is driving the programme. It's whether you are likely to meet, if you like, the virus when you head out. And we can never say absolutely 100% none of us will meet this virus at the moment. That's not possible. But we can say the levels are now so low. So as the Secretary of State said, the data last week before last, was on average in our communities, you would have to meet 1,700 people before you came across a case of infection. So it's trying, I think, to get that perspective and proportionality into people's understanding. And so the issue here is the epidemiology changes, so it's whether you meet the disease or not. For individuals, they will have a different risk if they meet it, but it's not actually, I think everybody quite reasonably is seeing it from their own disease perspective, where what we're saying is the epidemiology has changed. I think the bit that will help people going forward, we're coming up, we hope, to a sustained period of very low infection. I'm actually more concerned, I think, about if we get to the winter and we have cold weather and everybody hasn't continued to socially distance and keep on top of this. But what we will have, which will help employment discussions then, is hopefully this new assessment, a new tool, if you like, to support discussions. And what that will do is give that very individualised discussion with your GP or with your specialist, which will account both for the underlying conditions and some of the other attributes. You know, if for example, you are from a Southeast Asian background and are a young footballer, for example, your risk would be very, very low indeed. But if you are elderly, if you have other conditions, obesity, diabetes, or what have you, age is actually one of the biggest variables. But all of these things need to be factored together for your own individual assessment. So I think now is as safe as it's likely to be for a while. When it gets back to the winter, I think we're going to have a different tool, and that will help both the individual and the employers.
Thanks very much, Oliver.
Just one other quick one, if it's possible.
Sure, go ahead.
You mentioned about the retooling, essentially, this shielding list. Does that mean that you're developing the capabilities to instigate regional shielding lockdowns, for example? If epidemiological outbreaks were to break out, if contagion was more likely in a town in the northeast, for example, could shielding be issued there on a localised level using this new tool set that you're developing?
We will have the ability to do that, and we'd consider that as part of a local lockdown if that was what was clinically advised. Thanks very much. The next question is from Andy Woodcock of The Independent. Andy.
Hello, Health Secretary. You've announced some changes to the lockdown restrictions today, and tomorrow we're expecting further changes to lockdown restrictions. There's been a lot of hints that we're going to see the 2-metre social distancing rule dropped to 1. We're going to have hospitality reopening at the start of July. And yet the Independent SAGE group, led by the Prime Minister's former Chief Scientific Advisor, David King, says that it's much too soon to do this and the rate of infection is still far too high. If there's a division like that between the scientists and the politicians, which is playing out in public, wouldn't the public be right to suspect that these decisions, relaxations, are being made for social and economic reasons rather than to protect public health? And wouldn't they be right to be very concerned about that? And Dr. Harries, we've seen in Germany recently, they relaxed lockdown before us, and over the weekend, their R rate of reinfection seems to have shot up from just over 1 to getting on for 3 in the space of a few days. Our own R rate, according to what we can see, is only just below 1. How concerned are you that we're going to follow Germany down that route? And what sort of consensus do you think there is amongst the scientific and medical community that now is the time for this sort of relaxation? I mean, within SAGE, is it a consensus, or is it half and half, or just a bare majority?
Well, thanks, Andy. As you know, we've been guided by the science throughout this, and taking the advice of the scientists has been a critical part of working on the next stages in the plan. But as you can see from the chart, I don't know if you were with us at the start of the press conference, but at the start of the press conference, we could see that the number of new cases is coming down and the number of hospitalizations is coming right down. And you know, based on that data and on the clinical advice, that's what's been feeding into the decisions that the Prime Minister will be announcing tomorrow. And science always has competing voices, but we try to listen to all of the different scientific advice rather than just one individual. Jenny.
Yeah, so I'll perhaps pick up the Germany issue first. I think it's an important salient point to make to viewers and for all of us, that even where lockdown measures are being eased, we do all still need to follow social distancing rules, to keep washing our hands, keep catch it, bin it, kill it for respiratory hygiene. So all of those things still apply. So I think there is a critical point here that says just because life is feeling a bit more back to normal, don't suddenly jump to where you were, for example, this time last year. We need to learn to go forward with restrictions in our lives in order to get the maximum benefit from some of this easing. I think with Germany, I mean, what that shows is anything is possible, but I think we have built into the system in the UK to be able now through the Joint Biosecurity Centre and the data flows to be very clear where we may see hotspots, whether it be from an organisation or in a community, for example. And through the test and trace, working with directors of public health and local authorities, that means it's possible to identify them very early and not allow that to come through. But going on to your scientific point, I think, well, there's a very scientific technical point about the R value, because actually as numbers go down, it becomes a less reliable mechanism for counting. That's to do with low numbers of cases. So that is one issue. But I think we will be looking at both the growth rate of the virus in the UK, of the disease, and the R rate. The SAGE that gives advice to government, and it is advice, and it's the politicians who decide on the measures that they wish to take on a balance. So the advice that is given is already coming from a consensus of scientists. They give the advice and the politicians act on that advice. It is the consensus around that, and consensus as of last week was that R remains between 0.7 and 0.9.
Thanks very much. The final question is from Chris Lloyd from the Northern Echo. Chris.
Hello. Thank you for having me. The North East still has some of the highest numbers of coronavirus cases. ONS statistics for May show 3 of the 10 constituencies with the most deaths per 100,000 were up here: Blythe Valley, Bishop Auckland and North West Durham. All 3, incidentally, being seats which elected Conservative MPs for the first time in December. So what explains this higher rate? Is it lower economic levels? Is it care home policy? Is it something else? What has been going on in the regions? Then secondly, I think people caught up here, or people up here are caught, and they want to do their bit as you ease lockdown and shielding. They want to get out, but they're fearful because the statistics show that there are hotspots on their doorsteps. Are they right to be worried? How do you allay their fears? And then finally, the Conservatives won those seats partly because of the promise of levelling up the North East economy. Has the pandemic changed your approach? Is it all about physical infrastructure spend? Is it about social infrastructure spend? Is it about job creation or moving departments out of London? How are you going to level up?
Yeah. Thanks, Chris. It's great to have you on. And my absolute number one thing I want to say in response to your 3 questions is that the levelling up agenda is even more important with this pandemic. We've seen with the, including some of the statistics that you show, the importance of making sure there is a more even distribution of opportunity, of health and of wealth across this country. And that's what the levelling up agenda is all about. So we're going to redouble our work on levelling up as we come out of the coronavirus crisis. And it's going to be a very big feature of the years to come. I'll pass to Jenny on the scientific questions, but the final point I'd make is that the people of the North East have made sacrifices in an unbelievable way to ensure that we get this virus under control. The virus is under control in the North East as well as across the rest of the country. R is below 1, the number of cases is falling. The NHS in the North East has done an amazing job, right from having the very first case back in February, when it feels like an age ago, all the way through. And social care providers have done their part too. Of course, we need to look into why there was a difference in the numbers of cases and the number of deaths in different parts of the country. But all I can say is that I know that the people of the North East have played their part. Jenny.
Yes, thank you. So it reflects in many ways a sad truth, I think, about infectious disease, not just in the UK, but right across the world, where less affluent populations will be worse hit, and you've already alluded to that, and the opportunities there for the Levelling Up programme. I think to say whether people should be anxious, I would rather they were careful and concerned. It won't help if people are too frightened to go out, but actually if they are practicing all the social distancing measures themselves and still continuing to have social interactions, but limit the ones that are to just the ones that make them feel comfortable. So not exceeding that, not heading off to parties, not doing those ones which are more dangerous. Keep to the social distancing guidelines that we have now. They are there to keep people safe and to keep areas safe as well. So I think be careful and be cautious, but don't be too anxious.
Thanks very much, and thanks everybody for the questions. That ends today's coronavirus press briefing. Thank you.
So that's the end of today's coronavirus briefing there at number 10 Downing Street, led by Matt Hancock, the Health Secretary. Let's just recap some of the main points that came out of today's press conference then. It was also attended, by the way, by the Deputy Chief Medical Officer for England, Jenny Harris. 15 more people dying after testing positive for coronavirus in the UK in the last 24 hours. That, by the way, is the lowest daily reported increase in deaths since the middle of March. That's despite lower figures generally being expected on Mondays because of the lag in reporting of deaths over the weekend. Now, the total number of deaths in hospitals, care homes and the wider community now stands at 42,647. As you heard, important changes on shielding were announced for England. Now, from the 6th of July, those shielding will be able to meet in groups of up to 6 people outdoors. Shielding people who live alone or shielding single parents will also be able to access a support bubble with one other household. And those classified as clinically extremely vulnerable will no longer be advised to shield from the 1st of August. But the government did say it's possible that shielding will be put back in place in the future if it's needed. So it's essentially just paused from that date, was what Matt Hancock was saying. Let's get more from our health correspondent, Lauren Moss. And 2.2 million people who've been shielding in England. These very important announcements for them.
Yes, I mean, they were told to shield back in the middle of March for 12 weeks. That was extended to the end of June. And now this is an update today that so many people would have been waiting for. And when we speak about this group of people, we're speaking about those that would be most vulnerable to coronavirus. So people with specific types of cancer, if they're receiving certain types of chemotherapy, radiotherapy, recently had an organ transplant, or having treatment to suppress the immune system. It's these people, 2.2 million people in England. So just to recap some of the things you said there. I mean, they'll now, from the 6th of July, so the next couple of weeks, those people will be able to gather in groups of up to 6 people outside in England, as long as they're still following the social distancing guidelines. And then they will also be able to form a support bubble if they live alone with another household. And this was introduced for the wider population in England a couple of weeks ago. But this will include them being able to go indoors with another household and create that support bubble. So that's from the 6th of July. Similar guidance is being announced for Northern Ireland as well. And then from the 1st of August, a few weeks later, another big step forward. So in England, the guidance will be relaxed further. So those who are clinically extremely vulnerable in those groups I just mentioned will no longer be advised to shield. It's being paused. And if they need to work and they can't do so from home, they'll be able to return to the workplace, providing, as was said in the daily briefing, that people's employment can allow for those social distancing practices to be put in place. They'll also be able to go to shops, visit places of worship, again, strictly following the guidelines. So this is really a reflection of the falling number of coronavirus cases, that R number we hear a lot about, but also in the community and the rate of infection there. estimated in England to be around 1 in 1,700 cases of coronavirus now. So that's, is quite a huge step forward and will impact a lot of people.
Yeah, let's just talk through some of the figures that we were given, because all the statistics are basically going in a downward direction, and that has allowed the government to ease some of these restrictions, these kind of easing measures that we're seeing this week.
Yes, and like I said, with those steps that are being announced there's a few weeks in between them, so it will allow the government and the scientists to see how the relaxing of the lockdown measures will have an impact before then the shielding is paused at the start of August. So if we look at the slides that we were shown in the briefing earlier, the number of tests that are carried out as well, 140,000 done or provided in the last 24 hours, resulting in 958 new cases. And that's a real drop on what we've been seeing over the last few weeks. To put into context, a month ago, there were more than 3,000 new confirmed cases on this date in May. And you can see that downward line on the graph. And this correlates with the number of people being treated in hospital, down by 400 in England, Wales and Northern Ireland on 10 days ago, 380 people being treated with COVID in hospital. And again, bit of context there, more than 700 are being treated in England hospitals alone a month ago today. And we were also given the update on the number of people who've died after testing positive for the virus, 42,647. And these are the government figures showing a rise of 15, again, the lowest since lockdown began. Although, like we've been pointing out, after the weekend, we do tend to see a decline in the number of new recorded deaths and cases for them to rise a couple of days later. But on the graph overall, that 7-day rolling average, you can see it's clearly going downwards. And I would say that we are at a very crucial and sensitive junction in dealing with the pandemic now.
And just on that announcement about shielding, Lauren, Matt Hancock was saying the people who have been shielding, the 2.2 million, some of them will feel pretty nervous, frankly, about having been at home for so long, then suddenly going outside, meeting other people, and then eventually going back to work and so on.
Yeah, I think undoubtedly there's going to be some uncertainty about this and some anxiety probably around it too, although many people will be glad that the number of cases in the community is assessed to be at such a lower level now that it is safe to do that while following the guidelines. But some charities have been reacting to this today, saying it's been a difficult time. Macmillan Cancer Support say they hope that the support, though, that will still be available for these groups will be clear and easy to access. But other charities like Blood Cancer UK have criticised it a little and say it may give the impression that it's safe to not follow social distancing guidelines, perhaps, and that the virus is no longer a threat. That isn't the case. And so it is still important that when this advice does come in and the measures are eased in next month and August as well, that the guidelines are still followed.
All right, Lauren, good to talk to you. Thank you very much indeed. Lauren Moss there, our health correspondent. And we can get a political perspective on all of this from Nick Eardley at Westminster, who was also watching that Downing Street briefing. And this announcement on shielding today, of course, welcomed by the 2.2 million people who've been shielding in England. Part of a series of measures that we are expecting this week on easing the lockdown, including tomorrow maybe an announcement on cutting the social distancing 2-metre rule.
Yeah, that's right, Ben. It is a big week for finding out how some of the restrictions will be eased over the next few weeks in England. We start off with that really significant announcement for people who are shielding, and tomorrow we'll hear more from the Prime Minister. And the expectation is that tomorrow we'll get details of how the 2-metre rule will be relaxed down to 1 metre with some conditions attached for people who are indoors, for example, maybe going back to pubs or restaurants or shops over the next few weeks. We also think that tomorrow we will start to get some of those details about the next phase of lifting restrictions in England, which will see the hospitality industry allowed to open up again. As I say, bars, restaurants, given a chance to get customers back in with social distancing, probably along those new guidelines. It's a big moment, and as you heard Matt Hancock and Dr. Jenny Harries talk about in the press conference there, they're really encouraged by some of the figures we've seen over the last 24-hour period on the number of deaths and the number of confirmed cases being at the lowest level they have been since March. But it's a big political moment as well, because this is Boris Johnson, or tomorrow will be Boris Johnson, saying to people in England, look, this is how we see it going over the next few weeks. This stage of easing the lockdown hasn't always been smooth. We know that there were real troubles over getting primary kids back to school in England. There have been some missteps, some U-turns from the government over things like free school meals for children in England over the summer holidays, over the NHS app. That's not gone according to plan either. So it's a big political moment as well as a big moment for how we all live our lives. As ever, Ben, this one's for England, or the announcement tomorrow will be for England, just as the announcements today were for England as well. Scotland, Wales, Northern Ireland, slightly different.
Yeah, important clarification. Nick Eardley, our political correspondent there at Westminster, many thanks indeed for that. So let's just recap for you what the Health Secretary Matt Hancock said. He revealed those major changes to the recommendations for people who have been shielding in England during the coronavirus pandemic. In today's briefing, he said that from the 6th of July, those shielding will be able to meet groups of up to 6 people outdoors. Shielding people who live alone or shielding single parents will also be able to access a support bubble with one other household, and those classified as clinically extremely vulnerable will no longer be advised to shield from the 1st of August. This is what he had to say in the last hour.
Tomorrow, the Prime Minister will be able to set out the next steps in our plan to ease the national lockdown. But there's one group who've been more patient and given up more than almost any other, and that's the 2.2 million people who've been shielding in England. Wales, Scotland and Northern Ireland have their own shielding programmes, so what we say today is about England only. And since the start, the clinical advice has been to protect those who are clinically extremely vulnerable. Our shielding programme has delivered medicine, support and more than 3 million food boxes, and it's been integral to that plan. So just before turning to Dr. Harries, I want to speak directly to those of you who have been shielding. Like so many, I have friends, I have family who've been shielding, and I know what a burden it has been. Shielding has involved not leaving your house for months, not seeing people who you love, not being able to go to the park for some fresh air or even pop to the shops for something that you need. The sacrifice, though, has been for a purpose, and I want to thank every single one of you. We knew it was a difficult ask, but these measures have been vital in saving lives. Right from the start, we've been clear that we didn't want the shielding advice to be in place any longer than is clinically necessary. I'm very, very grateful to the clinicians who've led this work and kept the clinical advice under review.
Matt Hancock there, the Health Secretary, speaking a little bit earlier on. Now, Fiona Bruce will be here with the news at 6 in just a couple of minutes' time. But first, let's get a look at the latest weather forecast for you. That comes today from Thomas Schaffenacker.
Or love it or loathe it, but we are in for the hottest spell of weather since last summer. And by the middle of the week, widely across England, temperatures will be approaching or even exceeding 30 degrees Celsius. And with that will come also very high UV levels, so some strong sunshine out there. And here's the Europe-wide heat wave, the current of hot air coming out of Spain and France spreading across the UK. But the thinking is that by the time we get to the weekend, low pressure from the Atlantic is actually going to bring fresher conditions. So this low is going to win and push away the heat further towards the east. And with that, also we'll get some showers and thunderstorms, but that's not until the weekend. This is what's happening in the short term. Here, in fact, is a weather front. It's a boundary between the fresher Atlantic air and that hotter continental air. And where we've got that boundary, we have a lot of cloud and outbreaks of rain. But it's also quite humid here because the air stream's coming all the way from the south. So 14, 15 in Glasgow overnight, whereas under the clearer skies in England, temperatures will be around 11 degrees first thing in the morning. But that weather front will continue to be stuck between the hot high across the continent and the low pressure out in the Atlantic. So rather than this weather front moving across the UK, it'll be sliding along itself. So that means that pulses of rain will move through Ireland into Belfast and Glasgow and right across the Western Isles. But eastern Scotland and much of the country, certainly England and Wales, in for a bright, if not sunny day, and a hot one further south, up to 28 on Tuesday. Now here's Wednesday's weather map. In fact, the hot air is expected to spread northwards, in fact reaching northern England too. Temperatures in Newcastle of around 26 degrees and widely 30 or more across central and southern England. And then on Thursday, those temperatures will rise a little further, probably peaking at around 32 in London, and in the lowlands of Scotland around 26 degrees Celsius. And then towards the end of the week, we'll start to see low pressure approaching. Clouds will start to gather in the north of the country. And then by the time we get to the weekend, those temperatures will be quite a bit low. But we could peak at 33 on Friday in the southeast.